Hey everyone, and welcome. Today, we're going to dive into two real-life medical mysteries that, on the surface, seem totally different. But by following the clues, we're going to uncover a truth that is absolutely fundamental to all of modern medicine. I mean, just think about that for a second. It's probably one of the most terrifying questions a parent could ever face. A child is learning, they're growing, hitting all their milestones, and then things start to go in reverse. They start losing those skills. That's the mystery at the heart of our first story. So, what we're going to do is follow the doctors on their journey with these two children. And in doing so, we'll see why figuring out the why behind a condition is every bit as crucial as knowing the what. It's a principle that guides, well, pretty much every decision a doctor makes. Okay, so let's start with case number 1. I want you to think of this as a puzzle about function. Something in a young boy's body that was working just fine, suddenly wasn't. So here's what the doctors were looking at. A 6-year-old boy, he was starting to lose his ability to speak in full sentences. He was having trouble recognizing objects he knew just a day before. On top of that, seizures, difficulty walking, and vision problems all started to creep in. This is something called developmental regression, and it's just as heartbreaking as it sounds. It's when a child starts losing skills they've already mastered. So, the medical team gets to work, right? They're like detectives. First, they just observe. They note the symptoms, the regression. Then they move on to specialized tests, hunting for a very specific cause. They weren't just throwing darts at a board. They were following a trail, and that trail led them right to the genetic heart of the problem. And here it is, the diagnosis, a rare disorder called Batten disease. Now, neurodegenerative is a big word, but it just means that brain cells are breaking down over time. The easiest way to picture it is like this. Every single cell in your body has a tiny little cleanup crew. In this disease, that crew is missing a critical tool, an enzyme they need to get rid of cellular junk. So, without it, all that waste just builds up and up until it becomes toxic, especially to the brain. This is where our first big analogy comes in. Think of it as a software problem. The body's hardware, the brain's structure, the cells, it was all built correctly. But a single line of code, just one crucial instruction, is missing. And without that instruction, a vital process can't run, and the whole system starts to crash. So what was that missing piece of code? Well, it's an enzyme called TPP1. When they tested for it, they found its activity was critically low. That was it. That was the smoking gun. It confirmed the diagnosis and, maybe even more importantly, it pointed them directly to a solution. Okay, so let's pause here. If you know the entire problem comes down to one single missing ingredient, what's the most obvious, logical solution you can think of? Right, you just put it back. The treatment is called enzyme replacement therapy, and it's exactly what it sounds like. Doctors can directly supply the TPP1 enzyme that the boy's body can't produce on its own. Now, it's not a cure, but it tackles the root cause of the malfunction head-on and can dramatically slow down the disease. All right, now let's completely switch gears. Our second case is a totally different kind of mystery. This is not a story about something breaking down. This is a story about something that wasn't built right from the very beginning. It's a problem of form, not function. In this case, we have a 9-month-old girl. And right away, you can see the difference. She isn't losing skills like our first patient. The thing is, she never developed them in the first place. She can't sit up on her own, she doesn't babble, she has poor head control, and seizures started when she was only 3 months old. This isn't regression. It's a profound developmental delay from day one. Her diagnosis is a condition called lissencephaly. That name literally means smooth brain, and, that's exactly what it is. During development in the womb, the brain cells, the neurons, didn't travel to their proper locations. So instead of a brain with all the normal folds and grooves, the surface is, well, it's smooth, and this dramatically affects how it works. And this brings us to our second big analogy. If Batten disease was a software bug, this is a fundamental hardware flaw, a big one. The actual architecture of the brain was built from a faulty blueprint. And you can't just install a software patch to fix a problem with the physical hardware. And this is crucial, because you can't just rebuild the brain's structure after a child is born. So the entire treatment strategy has to be different. The focus shifts to supportive care. Doctors use medications to manage the consequences, like the seizures, and they use physical, occupational, and speech therapies to help the child reach their maximum potential within the limits of their condition. Okay, so we've got our two stories. One is a disease of degeneration, something breaking down. The other is a disorder of formation, something that wasn't built right. And when you put them side by side, you get to the core insight of this whole thing. And this slide right here is where it all clicks into place. In case 1, Batten disease, the problem is a broken process. It's a software error. So the goal is to fix the function. In case 2, Lasencephaly, the problem is a structure that was built wrong. It's a hardware flaw. So the goal is to manage the form. Understanding this one distinction, it's everything. So I know what you might be thinking. What about all the other cutting-edge treatments we hear about in the news? Stuff like stem cells or gene therapy. Why not just use those? It's a great question. And the answer, once again, comes back to the incredible precision of the diagnosis. Well, it comes back to that precision we've been talking about. Stem cells for these specific cases, they're still really experimental. High-dose steroids, they fight inflammation, and that's just not the problem here. And gene therapy? It holds incredible promise for the future, for sure, but it isn't an available standard treatment for these specific disorders right now. It all just reinforces the main point. You have to use the right tool for the job. And all of this really brings us to the core lesson, the big takeaway from these two powerful stories. It's an idea that is literally driving the future of medicine. It really boils down to this single idea. A great diagnosis doesn't just give you a name for the problem. It tells you the mechanism. It tells you why it's wrong. And knowing the why, well, that changes absolutely everything. So whether you're dealing with a software problem that needs a patch or a hardware problem that needs support and management, it's understanding that fundamental nature that lights up the correct path forward. And as we get deeper into genetic medicine, making this distinction is only going to become more and more important. And that just leaves us with one final, kind of mind-blowing question to think about for the future. As our ability to read the genetic blueprint gets better and better, will we one day move beyond just managing these hardware flaws and actually be able to correct the errors in the blueprint before the structure is even built? That's the hope. That's what drives science forward. Thanks for joining me for this one.